John Snow is celebrated as the father of modern epidemiology, and for good reason. His work during the 1854 cholera outbreak in London set the stage for how we understand and control diseases today.
This is one of the most famous landmarks in London medical history. This pump right here. We're on Broadwick Street in Soho, which in 1854 was Broad Street, in the middle of the slums and rookeries which constituted Soho at that time. And on the 8th of September 1854, on the instructions of the Dr. John Snow, the handle to this pump was removed so that water could no longer be drawn from it, because Snow had recognised that this pump, the water from this pump, was the source of the outbreak of cholera that had been ravaging Soho, killing over 500 people in the previous weeks.
What made John Snow unique was his ability to combine research, epidemiology, and biostatistics into one powerful approach that solved a deadly public health crisis. At the heart of John Snow's work was research. Research involves asking critical questions and finding answers through careful investigation. At the time, most people believed cholera was caused by bad air, but John Snow questioned this idea. He hypothesized that cholera was spread through contaminated water, and he set out to prove it. To do this, he used the tools of epidemiology. Epidemiology is the study of the patterns, causes, and effects of diseases in populations. John Snow carefully mapped the cholera cases in London and noticed that most of them were clustered around a single water pump on Broad Street. By analyzing this pattern, he identified the pump as the likely source of the outbreak. But Snow didn't stop there. He used biostatistics to strengthen his argument. Biostatistics applies mathematical and statistical methods to health data. By comparing the number of cholera cases among people who used the Broad Street pump with those who used other water sources, Snow was able to show a clear connection between the contaminated water and the disease. This evidence convinced local authorities to remove the pump handle, effectively stopping the outbreak. What makes John Snow's work so remarkable is how these three disciplines, research, epidemiology, and biostatistics, worked together seamlessly. Research provided the question and hypothesis, epidemiology uncovered the patterns and causes, and biostatistics quantified the results. Together, they solved a real-world problem and saved countless lives. However, it's also important to understand the differences between these fields. Research is the broadest of the three and focuses on generating new knowledge. Epidemiology narrows the focus to studying diseases in populations, while biostatistics provides the tools to analyze the data and draw conclusions. Each field has its own role, but when combined, they become incredibly powerful. John Snow's innovative approach didn't just solve one cholera outbreak, it changed how we think about public health forever. His methods laid the foundation for modern disease prevention and control, making his title as the father of modern epidemiology well-deserved.